Now we are discussing about a topic which is immune thrombocytopenic purpura. Firstly, in the question and answer session, the first question was about immune thrombocytopenic purpura, and I am repeating the question. The question was: all of the following statements about idiopathic thrombocytopenic purpura are true except, and the four options were: it is associated with the platelet specific autoantibodies. Now I confirm that it is a true statement because the idiopathic thrombocytopenic purpura, also called as immune thrombocytopenic purpura, it is associated with the platelet specific autoantibodies because the autoantibodies are destroying the platelets. The second option was it causes prolonged bleeding time. That is also true because thrombocytopenia occur, that means low platelet count occur, so there will be prolonged bleeding time. Next, it is often controllable by the immunosuppressive treatment. So those three options are correct, and the which exception, that means which is not true about idiopathic thrombocytopenic purpura, the statement is it causes more prolonged hemorrhage than hemophilia, because hemophilia condition is more dangerous than immune thrombocytopenic purpura because the ITP can be managed well. So now we are discussing in detail about the idiopathic thrombocytopenic purpura. First point is it is also called as immune thrombocytopenia. Okay, immune thrombocytopenia. Then it is an autoimmune bleeding disorder. Definitely our defense mechanism is attacking our own platelets. So it is an autoimmune bleeding disorder. The second point is it is an autoimmune bleeding disorder. Then thrombocytopenia itself means low platelet count. Okay, thrombocytopenia means low platelet count. Immune system attack and destroy our own platelets. Then it can be occur in two forms, that is acute and chronic. Usually in acute cases children are involved, and it may be due to some viral infection. It is sudden onset and mostly it is self-limiting. That is the features of acute immune thrombocytopenic purpura. Commonly the children are involved. It is usually maybe by viral infection, and it is sudden onset and can be managed. It is a self-limiting types. Then chronic cases, usually adults are involved. It is gradual in onset. It lasts more than 12 months. It is chronic onset. Okay, that means slow onset, and it lasts more than 12 months. Then the pathophysiology, the autoantibodies bind to the platelet and the platelets are destroyed. The platelet count drops. So due to this platelet count drop, there will be bleeding symptoms. That means there will be hemorrhages will occur. Clinical features include petechiae purpura and epistaxis. That means hemorrhage from the nose. Okay, and gum bleeding will be there. Heavy menstrual bleeding, and sometimes in severe but rare cases intracranial hemorrhages may occur, and in rare cases hematuria and GI bleeding also can occur. That means the bleeding can occur from anywhere. Okay. Usually petechiae and purpura, epistaxis, gum bleeding, these are the usual clinical features. Then heavy menstrual bleeding sometimes may occur. Then the investigation include how can we confirm that it is idiopathic thrombocytopenic purpura. So usually we will be encountering with the clinical situations like there will be severe gum bleeding, and now we suspect idiopathic thrombocytopenic purpura and we want to confirm it. Now we go for investigation. Then incomplete blood count, low platelet count, that means less than 1 lakh per mm cube. If you find a platelet count of less than 1 lakh per mm cube, then that means it's a low platelet count. So we have to, it's a confirmation for this idiopathic thrombocytopenic purpura. That means some problems are there with the platelet count. Then normal WBC count will be there, and hemoglobin will be normal. So these two are normal unless it is severe bleeding. Okay, in case of severe bleeding this may vary, but usual cases there will be normal WBC and normal hemoglobin, but only the platelet count is less than 1 lakh per mm cube. Then you have to suspect idiopathic thrombocytopenic purpura. Okay, then now we go for peripheral smear test. that obviously shows low platelet count, and the platelets will be large because as a compensatory mechanism, the body will start to produce more and more platelets, which will be immature and young. So in the peripheral smear test, we can see low platelet count but large platelets. Okay. Then sometimes we also go for bone marrow biopsy that shows increased megakaryocytes. That means platelet producing cells will be more. Bone marrow biopsy shows increased megakaryocytes. Now it is confirmed that it is idiopathic thrombocytopenic purpura. That means something associated with the platelets. And the treatments include, the first line treatment include corticosteroids itself. Usually prednisolones are administered. Okay, corticosteroid. We have to suppress the immune system by administering steroids. And then intravenous immunoglobulin. Another treatment method is intravenous immunoglobulin will be administered. If platelet count is less than 10,000, so now the platelet count is, there is severe decrease in platelet count. Less than 10,000, then there will be active bleeding. In such cases, we need immediate hospitalization. Okay, hospital admission is required. The same treatments, steroids administering as well as intravenous immunoglobulins administering should be given with a hospital support. Next is, what are the complications of this idiopathic thrombocytopenic purpura? There will be severe bleeding, and the side effect of long-term steroids will also be there. Okay, the prognosis, usually it can be managed well. Okay, so these are the things which have to be kept in mind about the idiopathic thrombocytopenic purpura. It is also called as immune thrombocytopenic purpura. If the platelet count is less than 1 lakh per mm cube, then we have to suspect idiopathic thrombocytopenic purpura. The symptoms will be purpura, epistaxis, and petechiae. Heavy menstrual bleeding will be there. The patient will report such history that I have. When we examine in the oral mucous membrane, we can see petechiae, purpura. If such bleeding spots are present, then suspect what? Idiopathic thrombocytopenic purpura also. Okay. Then confirmation means CBC, low platelet count less than 1 lakh per mm cube with a normal WBC as well as hemoglobin, unless the bleeding is severe. Okay. Then we have to go for peripheral smear test. We can see a low number of platelets which are large and young. Okay. Then bone marrow biopsy shows increased megakaryocytes. Treatments include administer steroids and the intravenous immunoglobulin. But in case of severe bleeding, such as if the count is less than 10,000, then we have to go for the hospital admission. Then start intravenous immunoglobulin or steroids urgently. Then complications include severe bleeding and side effect of this long steroid treatments and all. Prognosis means it can be